to COVID. 2 states in 2 days now, with California now reporting its first Omicron variant COVID-19 infection, and now Minnesota. The Minnesota Department of Health confirming the variant in a Minnesota resident today. It is a worrying trend to some degree. The variant undoubtedly is going to go all over the world as the nation braces for the possibility of a new COVID surge during the winter, when it naturally rises during the cold weather and everybody's inside together. Health officials have already warned about the transmissibility. They aren't 100% sure, but it seems more transmissible, this new variant. And they urge everyone to get vaccinated and boosted and practice safe COVID guidelines like social distancing and wearing a mask. Chief Innovation Officer at Boston Children's Hospital, ABC News contributor Dr. John Brownstein joins us now. So, Doctor, we just heard President Biden a little bit earlier speaking from the National Institutes of Health about his new COVID-19 winter plan. And you were with us, so the points that he wanted to make: expand access to boosters. He talked about family booster sites and vaccination sites, expand vaccinations for children, free at-home rapid tests, extend public transit mask requirements, and stringent testing for international travelers to get a handle on how it may get into the country. What do you think of these 5 points?
You know, overall, I think they're really important. They're all about protecting the public health and staying ahead of variants. I think 2 in particular are ones that we've been waiting for a while, which is increased testing, making it more available and accessible, distributing these tests to Americans, make it easy to test. We've always said that that's our way out of the pandemic. And then get more immunity into the population with a focus on boosters and kids vaccination. So expanding access in pharmacies, better education, paid time off, and this idea of family clinics where you can get both the parents and kids vaccinated at the same time, super important. I think more can be done, clearly. These at-home tests have to be submitted to insurance. Why not make them just fully free? More investment in local public health. I'd love to even see mandates for flying. I mean, why not have to be vaccinated in order to get on a plane? But the real important point here is we're not going to get to the other end of this pandemic without vaccinating those who have yet to get that first shot. We still have a large portion of Americans that are yet to get that first shot. Actually, 78 million who are eligible have not gotten one shot. So that's a problem. Yes, we've seen a real increase in demand, over 2 million doses in the last day. So that's great. But I think we have a long way to go if we're really going to stay ahead of Omicron and any other future variant.
So, Dr. Brownstein, let's talk about this second confirmed case of the Omicron variant. In this situation, it's a vaccinated adult who traveled to New York City for an anime convention with 53,000 attendees. Officials are saying that he developed mild symptoms, which have now ended. So what does that tell you about this new strain? Because the case that we saw, that we talked about yesterday, the first case that was detected in California, it was the same description: vaccinated traveler, mild symptoms.
I think it's too early to really summarize anything about Omicron based on just a couple cases. But what we do know, and it's what we actually spoke about 2 days ago, is that this virus was already in the U.S. and moving quickly. This second case had no travel history and, of course, was at a large conference where likely there was additional transmission. So Omicron's been around. And, of course, we debated, whether, in fact, flight restrictions were even worthwhile, because in fact this variant is already here, and I think this is what we're finding right now. So we still need time. There's a lot of work that's being done by scientists across the globe, especially those in South Africa. They're spending a huge amount of time to understand transmissibility, understanding reinfection. We're seeing some preliminary data that there might be some additional risk of reinfection with Omicron, but we still don't have hard information, and that's what needs to be done: work on understanding transmissibility and understanding vaccines. That's going to take time, but what we recognize is that we have to be vigilant. Of course, we're not in a year ago where we didn't necessarily have a vaccine and we had more challenges. We have therapeutics, vaccines, testing, but we have to double down on all of it if we're going to stay ahead and prevent a winter surge, which we're really concerned about right now.
Just got to keep at it, and it's a hard message for people to hear, but we appreciate you bringing it to us with your usual clarity and kindness. Dr. Brownstein, thanks very much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.